Good morning, everyone. My name is Zainab Danani. I am a brown-skinned South Asian woman in my late 20s with medium-length black hair and brown eyes, wearing a gray blazer and a blue blouse. I am a medical student here at Stanford and the founder and executive director of the national organization, Medical Students with Disability and Chronic Illness, also known as MSDCI. I want to take a moment to warmly welcome and thank all of you for joining us today for the 4th annual Stanford Conference on Disability in Healthcare and Medicine, hosted by the Stanford Medicine Alliance for Disability Inclusion and Equity and Medical Students with Disability and Chronic Illness. When I first dreamed up this conference, it was with the mission of advancing the conversation around disability in healthcare, from providers to trainees to patients. The skills and insights of individuals with disabilities in healthcare are vital to improving the healthcare of all patients and addressing the jarring disparities that have persisted for decades. Even prior to the pandemic, it was well established that people with disabilities faced innumerable barriers to healthcare access and equity. But with the onslaught of a global pandemic and an overworked, ill-equipped healthcare system, we saw those gaps in equity widen further. And yet, the disability community remains an often unrecognized and underappreciated minority in medicine. But this conference was founded on the belief that disability is diversity, and it is an honor to see how that fundamental belief has led to the growth of this conference over the years. The past 3 years have yielded over 3,000 registrants from over 40 countries, with more viewers tuning in to recordings we've posted online. We have hosted over 24 leaders in disability advocacy and discussed a wide range of topics, from disability law and current research to the value of cultural humility and the importance of including disabled providers. We've touched on the ethical considerations for the disability community during COVID and on how to launch disability advocacy efforts, and on mental health and stigma in the disability community. We have taken your suggestions and used them to bring you a more interactive, diverse, and meaningful conference year after year. Our first disability conference took place in June of 2020, originally planned as an in-person event that was made virtual in light of COVID-19. What was originally a conference with a registration cap of 120 participants became a collective movement with over 1,200 registrants. The momentum from this first conference also led to the growth of MSDCI National. For those who have not heard of us, we serve as a community of advocates, learners, and educators who are passionate about disability inclusion in medicine. We've developed resources for supporting medical students with disabilities, advocated for better disability-focused training in medical education, passed AMA policies on mistreatment based on ableism, use of accessible diagnostic medical equipment, and disability education. We've hosted resident panels and events with disability speakers and activists, and have launched several research projects aimed at better assessing the experiences of students with disabilities and disability-related training in medical education. I want to emphasize this trajectory because it is a reminder for myself that the best step one can take in making progress is to just start. This conference was originally a passing idea during a conversation at a campus cafe, but with the incredible mentorship and support of Dr. Peter Poulos, it became this collective movement. If there's anything I can impart on all of you today, it is to give value to your ideas and pursue them despite your hesitations, as you never know how many others are looking for exactly what you are creating. Promoting access and inclusivity is not a passive endeavor, but requires us to invigorate our convictions with action. We know from Dr. King that the arc of the moral universe is long, but it bends towards justice. I remain grateful for each and every one of you who joins us in this long yet noble pursuit. Thank you again for being here with us today. Please join me in welcoming my mentor and dear friend, Dr. Peter Poulos, as he too shares his insights and wisdom with us all today. Thank you.
Good morning and welcome, everyone. I'm Dr. Peter Poulos, an abdominal radiologist at Stanford and founder and co-chair of the Stanford Medicine Alliance for Disability, Inclusion, and Equity. I'm a well-developed, well-nourished white male in no acute distress. I have brown hair, blue eyes. I'm in my middle age, but look a little younger and have a half smile. It's so wonderful to have you with us on what is a beautiful and sunny day in California. And I hope it's a beautiful day wherever you are also. I feel so fortunate we have attendees so passionate about this subject that they are willing to spend a Saturday with us. We have today with us people from over 35 countries from all over the world. This is a banner that says welcome in English with translation in 35 different languages within the letters. So to those of you from Argentina to Egypt, from Israel and the Netherlands to Pakistan and Singapore, welcome. This has been a very productive year for SMATI and MSDCI, and I would like to thank all of our leaders, board of directors, our committee members, collaborators, and active members for their extraordinary contributions. My computer is lagging. A special thank you to our major funders, the Stanford Department of Radiology, the Office of Faculty Development and Diversity, and the Stanford Healthcare Office of Inclusion, Diversity, and Health Equity. And I would like to thank each one of our sponsors, the School of Medicine Human Resources Group, the Stanford University Diversity and Access Office, the Stanford Medicine Departments of Radiation Oncology, Chemical and Systems Biology, the Stanford Maternal and Child Health Research Institute, the Byers Eye Institute and Department of Ophthalmology, the Department of Obstetrics and Gynecology, Biomedical Data Science, Otolaryngology, Head and Neck Surgery, the Department of Medicine, Department of Surgery, and Psychiatry and Behavioral Sciences. Thank you so much. We're committed to keeping this conference free and accessible to the maximum number of people. We only ask that those who can donate according to their own financial means. Donations sponsor this conference and not only enable us to produce and broadcast, but also keep our programs going throughout the year. So to those of you who have already donated, thank you very much. To those of you who have not, please consider doing so. The information to donate is in the chat. It would be impossible to detail in a short period of time all the projects we've been working on, but I'd like to highlight the work of some of our committees, which have helped focus and clarify who we are and what we hope to achieve. Bylaws are not my favorite thing, as people know, but they are extremely important. And the Bylaws Committee with Sarah Nichols, Shelby Stewart, Zoe Martin Lockhart, Doug New, and Joseph Garner have been hard at work defining and refining ours. When I first started SMATI in 2018, I sort of made up our mission and vision on the fly, but over time and through the work, we've brought them to a higher level. And I do want to share our values, vision, and mission with you because they're inspiring. I'm going to zoom in on each one of these. And forgive me for reading the slides, but we wordsmithed these for a while. So we believe in a world where disability is celebrated as an integral part of human diversity, inclusivity, and equity. As Zainab said, too often disability is left out of diversity language and efforts, and this needs to change. If the reason we value diversity is because it makes us stronger, and the reason it makes us stronger is that different upbringings, experiences, influences, fields of study, interests, and life strategies are important, then disability must be included in DEI efforts. our vision, we endeavor to transform the culture of Stanford medicine and beyond from one of compliance to proactive anti-ableism, where patients, employees, and trainees with all abilities can thrive. As Alice Wong taught us last year, ableism is a system of oppression. And she shared Talila Lewis's working definition of ableism, which I will read. And this is why cross-disability and cross-movement organizing are so important. It takes all of us to take down this system. So ableism assigns values to people's body and minds based on societally constructed ideas of of normalcy, of productivity, desirability, intelligence, excellence, and fitness. And these constructed ideas are deeply rooted in eugenics, anti-Blackness, misogyny, colonialism, imperialism, and yes, capitalism. This systemic oppression leads to people in society determining people's value based on their culture, age, language, appearance, religion, birth or living place, their quote unquote health or wellness, and their ability to satisfactorily reproduce, excel, and behave. And importantly, you do not have to be disabled to experience ableism. Our mission. We advocate for resources, education, training, policies, accessibility, and services at Stanford Medicine and beyond, not guided solely by law and an accommodations-based approach, but by dismantling systemic discrimination through universal design. We encourage synergy and collaboration within and beyond Stanford community in service of justice. Universal design assumes that people with disabilities exist, that we are important and we are valuable. And you'll notice that the vision and mission both say Stanford and beyond. Stanford is not perfect by any stretch, but we are supported and we are trying to let our visibility and existence inspire you and your institutions to engage in the work and to bring justice to the disabled community. We have also been working on funding, and our funding committee has developed a proposal to Stanford Medicine leadership to fund the SMATI initiative and to hire an executive director and other staff to keep our projects moving forward, while the rest of us full-time students, providers, and employees are all doing our day jobs. Members of this committee include myself, Amanda Taus, Ellen Zanino. We're led by Jennifer Stolman of Jennifer A. Stolman Consulting. Working on this proposal has helped us clarify exactly what we hope to create and has helped us draw some boundaries about what we don't want to do. So these are our 6 mission functions: research, advocacy, community, education, health equity, and mentorship. Today at this conference, we're hitting or highlighting all of these mission functions, but I want to highlight in these welcoming remarks the mentorship program because I'm particularly proud of it. The Disability in Medicine Mutual Mentorship Program, or DM3P, was founded as a joint project of the Society of Physicians with Disabilities, MSDCI, and SMATI. We've been meeting since late 2020, once per month, for sessions that vary according to the topic, but have included didactic lectures, panel discussions, small breakout room discussions, and large group meetings. There are also opportunities for unstructured social and networking time before and after the formal programming. The mutual mentorship model is flexible and celebrates interdependence and recognizes that one's disability knowledge doesn't correlate with one's academic rank. We also have opportunities for asynchronous mentorship in the form of a private LinkedIn and Discord group, as well as a public website, which is currently being built up with materials from prior meetings. Please join us. We are open to disabled healthcare workers, trainees, students, and allies. There's no charge, and this is our web address and email, disabilitymedmentors.org and info@disabilitymedmentors.org. This is our leadership team. Our executive director and co-founder is Dr. Suchita Rastogi, an MD PhD student at Stanford Medical School and a member of the SMATI Board of Directors. Her vision and leadership inspire her team. Amanda Taus is a co-organizer. She's a graduate student and practicum student in neurology, as well as a DEI and dialogue facilitator. She's the most recent member of our leadership team, but has made an immediate impact with her breadth of knowledge and vivacious wit. Zoe Martin Lockhart, who you will meet later today when she facilitates the panel on social media, is a PhD candidate and MPH student at the University of Illinois, Chicago. She's also the curator of the incredible Docs with Disabilities resource and research rounds. Dakeen Campbell is our administrative support. She is a DEI and education projects coordinator in the Department of Obstetrics and Gynecology. She's also a member of the SMATI Board of Directors. And what to say about Dakeen? What would we do without her? She runs so much of the back end of our operation and keeps us moving forward. Then there's me, co-chair and co-founder of the mentorship program. Ken Sutha is the co-chair of the program and also of SMATI, like myself. He's an instructor of pediatric nephrology, and you'll meet him later today when he moderates the synthesis panel. He's my partner in crime in all things SMATI and mentorship, my right-hand man, my better half, my brother from another mother, and my external hard drive. Last but not least, Joe Kim is our third co-chair. Joe is the founder of the Society of Physicians with Disabilities, a huge ally of the disabled community who's been involved and supportive from the very beginning with all of my pie in the sky ideas. Thanks to everyone. I have two more things to promote. First, for those of you who don't know, Dr. Lisa Meeks, my friend and mentor from the University of Michigan, was given funding for her Docs with Disabilities initiative. And this is the umbrella organization for all of the incredible work that she's doing in just about every space in disability and healthcare. I would encourage you to check out her website and all the resources they have there, the Disability Resource Professional Academy, the podcast, Access in Medicine, the research and resource rounds, the DREAM Consortium, Women with Disabilities in Medicine, the International Council for Disability Inclusion in Medical Education, DREAM Research Rounds, the Research Lab, and DIGME. And of course, as co-host of the Docs with Disabilities podcast, I encourage you to take a listen. Another new initiative that's starting up in the medical humanities is Didactics, a new publication launching that hopes to highlight the art, writing, and perspectives of people with disabilities and other identities traditionally underrepresented in medicine and the humanities. And this publication is launched out of Stanford's disability community, but it's been a collaborative effort of people at multiple universities and medical schools. The idea for this publication is that in order to advance health equity and and social justice, it's important not just to share stats and research, but to share stories, perspectives, and experiences through written narratives, storytelling, art, and the humanities. Didactics also hopes to provide an opportunity for people doing good work in the medical humanities to gain academic currency for their work. They will provide DOIs such that the work will be citable and able to be placed on a CV, just like any other research publication. The didactics team has asked us to put out a call to all of you to get involved. They'd love to hear from you. They're currently accepting submissions for their first volume, which has the theme of introductions. And since this is the first one, after all, it has a flexible theme, and there's more information about it on their website. For the first volume, submissions are due May 21st. If you'd like to stay updated, you can sign up for their Substack on the website. And if you'd like to be more involved as an editor, reviewer, or something else, or if you have other questions, you can contact with them via their website or contact Lily Reed at reed@stanford.edu. And here's their social media. I know you can't read this, but information will be provided throughout the day multiple times for claiming CME, as well as in the chat and on our SMATI website. We're accredited for 6 hours of AMA PRA Category 1 credits. And with that, I am going to pass on the conference to Ms. Claire Ryan from the University of Texas at Austin. Thank you very much.